Thank you very much. My name is Kipkoech Bernard Ngetich. I am speaking in my capacity as Litein Mission Hospital Board Chairperson. And this morning, I want to very sincerely celebrate the successes that Litein Mission Hospital has had in the last 3 years. Today, the 9th of January 2026, we're celebrating yet another milestone as we commission an ultra-modern eye care center. This eye care center is a new addition in some of the achievements that we've had as Litein Mission Hospital. Going forward, therefore, as a hospital, with all the personnel, with the facilities that we've had in the newly commissioned eye care center, Litein Mission Hospital would be able to deal with many issues around eye problems. About 2 billion people across the world suffer from eye problems. About 1 billion people of these 2 billion people are suffering from situations and conditions that would have been treated if they had been taken to necessary and relevant people. So this morning, I want to celebrate a milestone, which is a newly launched eye care center, which is going to treat so many people that we've been treating within the 8 counties around our region. I want to very sincerely thank our partners who've supported us, who've helped us to come up with the infrastructure and have been able to equip this facility, and have offered to continue equipping these facilities and through an exchange program, see to it that we have personnel across the world, across the globe, who would be coming to benchmark with our personnel, who would be coming to share lessons with our doctors, with our assistants in the newly established eye care center. So as Litein Mission Hospital, going into the future, the community around, that is in Kericho, in Bomet, in Gusii counties, in Narok, Nakuru, Eldoret, which is in Uasin Gishu, Baringo, and several other counties across this country would be benefiting. Litein Mission Hospital has been serving patients whom we call angels, otherwise clients, across 8 counties. As we move forward with the establishment now of an expanded ultra-modern eye care center, we should be able to see more angels, that is patients, across this country. And that is why, again, I want to thank our partners who've invested in us, who have trusted in us. As a hospital, as a board, as management, we've committed ourselves to make sure that we account to the very last cent. And to the community, to our patients, we promised as a hospital that we shall ensure that the turnaround time when you visit us is going to reduce significantly. And if you are detained in the hospital longer, it will be for purposes of medical investigation, which we expect to be more rigorous, which we expect to be incisive, and which will be for the benefit of the patients. Again, through the quality assurance committee, which we've established in the board, we want to make sure also that our quality of service increases, matches with the ultra-modern infrastructural developments and equipment that we've put in as a hospital. So as a hospital this morning, we want to celebrate our partners, we want to celebrate the board, we celebrate the management, we want to celebrate AIC Kenya, which owns this hospital, and the local community and this country. The only issue that as a hospital concerns us is, again, we want to thank the government for the support that it has given us in terms of policy, in terms of ensuring that as a hospital we benefit and we treat patients from the Social Health Authority. What we're only asking the Social Health Authority is to ensure that going into the future, repayment and reimbursement of cost incurred through the Social Health Authority are remitted to the hospital within the shortest time possible. As we speak today as a hospital, Social Health Authority owes this hospital around 100 million. This is excluding what the National Hospital Insurance Fund owes this hospital, which is verified 180 million shillings. Otherwise, our claim against NHIF, which is now defunct, is 300 million. But what is verified is 180 million. That is why, as supporters of the government, as supporters of universal health coverage, this morning we want to beseech the government to ensure that SHA be able to reimburse hospitals necessary cost, necessary expenditure within record time. As a hospital, I have mentioned that we pay salaries of about 32 million shillings every month. Our suppliers take about 5 million shillings every month. That is to say, our recurrent expenditure is about 37 million shillings every month, and that is why, as an institution that supports the government and that works with the government, we want to beseech the government this morning to ensure that due expenses, due money, due reimbursements as a result of treating various Kenyans from various parts of this country, which now is about 100 million shillings, be paid expeditiously so that we are in a position to serve this country and serve our patients better, pay our suppliers within record time, and ensure that we also enhance the quality of service that we offer to our patients, and ensure that the turnaround time is checked and we take our services to the next level. Thank you very much.
Okay.